Hi, and thanks for joining me on this overview of 211 in Ontario. My name's Jackie Roddy, and I'm the Partnership Development Manager for 211. By the end of this session, you should have a really good idea on what 211 is, our core services, how to access 211, and how we can help you navigate the human service system for yourself or for your clients. 211 is an N11 number, and we sit somewhere between 911 and 411. In Ontario, 211 is a system comprised of 6 regional service providers, numerous data partners, and Ontario 211 Services, who are the stewards of the system. The 6 regional service providers are the providers for our contact centers and are located in Thunder Bay, Collingwood, Windsor, St. Catharines, Toronto, and Ottawa. Ottawa is the bilingual center, and Toronto provides service to Toronto, Peel, Durham, and are also the overnight and weekend service for the rest of the province. Collectively, these 6 centers serve the entire province 24 hours a day, 7 days a week, 365 days a year. The 6 contact centers are integrated in the provision of 211 core services. 211 core services can best be explained in 3 parts. The inquiry service, answered by certified community resource specialists. Resource database, which is maintained by certified community resource database curators. And reporting, where aggregate user data is categorized, enabling us to report on community needs and unmet needs. Although 211 started as a phone number, it now has multiple channels of access. 211 can be accessed by phone, literally by dialing 211. You will be initially greeted by an IVR for language selection and an opportunity to participate in a post-call survey. The phone number is available 24/7, 365. Chat is available on our website at 211ontario.ca, and you may see it on other websites. And it's available Monday through Friday, 7 a.m. to 9 p.m. You can access us by email by emailing gethelp@211ontario.ca and online at 211ontario.ca, and you're actually greeted by the search portal, which is on the front page. All channels of access are answered by information and referral specialists, also known as community navigators. Our specialists are trained in effective communication. They're certified by the Alliance of Information and Referral Systems, and most have at least an undergrad degree in social work or the humanities. They are further trained in how to use the database. When a call or chat comes in, the navigator will ask questions pertinent to the situation that's being presented, so they can get really at the crux of the matter. It isn't unusual for a caller to present a situation or ask something that requires a navigator to probe. An example might be someone who calls asking for help in finding a job. Through conversation, it's revealed they can't pay their utility bill or their rent is going up. The navigator will help them prioritize and set a course for what to do first. The caller might also need someone to advocate on their behalf. Our navigators cannot fast track through wait lists, but they can work with the caller and agency to access services. The navigator may also provide follow-up. This is offered in situations where the navigator feels the caller may have difficulty acting on referrals, but is insisting on doing it on their own. Finally, at the end of the call or chat, the navigator will complete a call report that collects basic demographic, caller's needs, and referrals provided, and in some case, where the need has gone unmet. The path to inquiry is all channels, except the online portal, are answered by a community navigator. The navigator does a non-clinical assessment, will provide information, assistance, and referral, will offer advocacy and follow-up where warranted and wanted, will document the interaction as to the demographics of the client, the needs presented, and the action taken. All inquiries are confidential. The service is fully bilingual and has multilingual capabilities with access to more than 150 languages through real-time interpretation. The phone service and online portals are available 24/7, 365, chat and text Monday through Friday, 7 a.m. to 9 p.m., and emails are answered within 48 hours and usually within 24. Of course, in order to provide referrals to clients that call, we need to have a database. What's more, for us, the database has to be consistent across the province so that if somebody calls, say from Mississauga, and the call is answered by a community navigator based in Scarborough, it's important that the community navigator can actually get to the service. The database contains information about the programs and agencies delivering them, including hours of operation, accessibility, application process, and eligibility requirements. Each record is indexed using a standard taxonomy of terms. In addition, every field of every record is verified at least once a year. Many records are updated more often as the information changes. When an agency staff member moves on, new programs are added or programs are defunded and removed. All 211 data adheres to the AIRS standards. You're also going to be provided a YouTube video on tips and techniques for how best to search the online portal. Our database is also used by a number of our partners, and they use them on their websites for search portals. Here are just a few examples. Settlement.org, a program for newcomers to Canada, use our database and our chat service on their website. Toronto Police Services use the database for community asset mapping. 211 North, based up in Thunder Bay, they use the database for Northwestern Ontario. And Ample Labs, who have developed Chalmers Bot, which is a chat bot for people experiencing homelessness, so that they use our data so that the person using the chat bot can quickly be able to access services such as shelters, free meals, clothing, and in various parts of Toronto. They're also now in Hamilton and Halton. Reporting is a third part of 211 services that has become more and more useful in the planning for service providers and decision makers. We do have a public dashboard of the data, and if you recall, every interaction is documented, and that aggregate documented information is provided into this dashboard. So if I go back over to the first page here, this is what we call needs identified. And in Ontario, 8,559, this is for Peel. In Peel, 8,559 needs were identified. We can drill down on those needs here through the drill down. Takes it even further down. Emergency food. Let's take a look at specialty foods. And this is for Peel. So formula and baby food. And we could also do it for the whole, you can do it for the whole province as well. Drilling back up here. If we take off the drill down, and for all of Ontario, 222,000 needs identified between January 1st and the date of October 6th. What's also interesting about this is the top 5 needs and the breakdown by geography, and then the total needs met by month. On the next page of this public dashboard, you'll also see unmet needs identified. Likewise, you can drill down on any of these. You can also filter, again, by Peel, by one of the cities within the Peel region, age, gender, and language. The unmet needs also gives you the reason why the need was unmet. No resource was found, or hours of program, the person couldn't access it. Maybe there was a full waiting list or a language barrier. So this dashboard can be very useful to planners when they're trying to design services within the province of Ontario. So again, this is the dashboard, and what I did do is I did some still frames so that in case the internet wasn't up, I could always just show you these dashboards. 211 is certainly powered by partnerships, and every partnership or cooperative relationship is different, utilizing different parts of 211. The Ontario Caregivers, for example, 211 community navigators answer their helpline and chat service. The navigators use the 211 resource database to guide caregivers, and we report the needs back out to the caregiver organization for their planning. Feed Ontario, they used our contact data, or the contact data that came into 211 as it relates to food insecurity to help with service planning. And more recently, the Ontario Psychological Association advertised 211 as the number for frontline workers not covered by extended health benefits, for them to call and register for 6 free sessions with a psychologist specific to the impact of working the front line, think service industry, and worried about the impact of COVID. It's really important that we have partners, because the more people that use the inquiry service allows for richer reporting of needs data in Ontario, which in turn provides evidence for the development of programs and services that are going to meet those needs. This is a short video of 211 in Ontario and as it relates to 311
How do you
municipal.
connect with over 60,000 community and social services across Ontario? It's simple. Call 211. Meet John and his family. They're new to the community, but they need help. Are they making the right call? For life-threatening emergencies, of course, John would call 911. But not for noise complaints or things like bylaw enforcement and garbage collection. That's 311. But 311 is only available in some Ontario communities. From anywhere in Ontario, call 211 when you don't know where to turn. For things like home care support, mental health, employment services, community programs, housing and income supports, and so much more. 211. Finding help is easy when you make the right call. How do you connect with over?
In summary, 211 is a public utility, free for you and your clients by phone, email, chat, text, and portal search. 211 resource database is community-based and up-to-date. 211 reporting provides aggregate data of client needs and unmet needs and can be filtered by location and other criteria. If you have any questions about 211, please contact me, jroddy at 211ontario.ca. But if you're looking for information about community, government, or social services, please dial 211 directly, search our database, or use the chat and email function on 211 Ontario's website. Thanks for joining me today, and you will be receiving a YouTube video on tips for searching the public search portal. Thanks, and have a nice day.